Assalamu alaikum everyone and welcome to the fourth lecture of the antifungal drugs. Dear student, in today's tutorial we will talk about the azole antifungal drugs. But before that I am going in the detail of azole antifungal drugs. First of all, I want to tell you about the azole. That's what's mean by azole. So azole is a antifungal drugs which act on the cell membrane of fungi and have two types. One is imidazole, which is used topically for the cutaneous infection, and the second one is a triazole, which is used systemically for treatment and prophylaxis of systemic mycosis. So this is the general introduction of azole. Now move forward to the example of the azole. So the example of azole is the ketoconazole, fluconazole, itraconazole, meconazole, etc. But in today's tutorial we will discuss about the fluconazole. So what is fluconazole? Fluconazole is a triazole antifungal drug. As we already discussed in the type of azole, that azole have two types, imidazole and triazole. Imidazole is used topically for cutaneous infection, while triazole is used systemically for treatment and prophylaxis of the systemic mycosis. So fluconazole is a triazole antifungal drugs used orally for systemic mycosis, are used orally for the fungal infection and works against many fungi. So this is the general introduction of fluconazole. That's fluconazole is our triazole antifungal drugs used orally for systemic mycosis, are used orally for the systemic fungal infection and work are active against many type of fungi. So this is the general introduction of the fluconazole. Now move forward toward the mechanism of action of the fluconazole. That how fluconazole work against fungi. So fluconazole inhibit the fungal enzyme known as Lanosterol 14 demethylase enzyme. Actually, this fluconazole inhibit the Lanosterol 14 alpha demethylase enzyme, which is responsible for the conversion of the Lanosterol into ergosterol. So fluconazole bind to this Lanosterol 14 demethylase enzyme and stop the conversion of the Lanosterol into the ergosterol, leading to the abnormal membrane or leading to the abnormal cell membrane of the fungus. When there is the inhibition of the Lanosterol 14 demethylase enzyme, there is no conversion of the Lanosterol into the ergosterol and leading to the abnormal cell membrane of the fungus. You people can see the diagram that Lanosterol is converted into the ergosterol by an enzyme known as Lanosterol 14 demethylase. So fluconazole bind to this Lanosterol 14 alpha demethylase enzyme and inhibit the conversion of Lanosterol into the ergosterol. You people can also study this type of diagram. That this is the Lanosterol which is converted to the ergosterol by an enzyme 14 alpha demethylase enzyme. So fluconazole actually bind to this enzyme Lanosterol 14 demethylase enzyme and stop the conversion of Lanosterol into the ergosterol. Or you people can say that fluconazole actually stop this step and the synthesis of the ergosterol synthesis. So inhibition of the ergosterol synthesis disrupt membrane function and increase permeability of the cell membrane and leading to the death of the fungus. So this is the mechanism of action of the fluconazole. Next topic is resistance to fluconazole. So how resistance are developed to fluconazole? Resistance developed due to mutation in enzyme. The enzyme through which fluconazole is bound. When there is mutation in this type of enzyme, so leading to the resistance to the fluconazole. And the second one is efflux pump in some fungi which expel out the drug. In some fungi there is a pump present known as efflux pump, and this pump is responsible for the expelling out of the drugs from the cell of the fungi, leading to the resistance to the fluconazole. The next topic is the contraindication. Contraindication is the condition in which we can't administer fluconazole. So contraindicated in pregnancy due to its teratogenic effect. Fluconazole is contraindicated. We can't administer fluconazole in pregnancy. Why? Because of its teratogenic effects. So this is the resistance mechanism and contraindication of the fluconazole. The next topic is pharmacokinetics of the fluconazole. So fluconazole are administered orally and IV routes and highly water soluble drugs and wide therapeutics index. We people can administer fluconazole both orally and through IV routes. And fluconazole have a high water soluble drugs and wide therapeutics index. Therapeutic index mean the gap between effective dose or therapeutic dose and toxic dose. So this gap is known as therapeutic index. So fluconazole have a wide therapeutic index and will absorb from GIT and not affected by the gastric juice. Fluconazole are will absorb, highly absorb from the GIT and not affected by the gastric juice. Gastric juice doesn't decrease the absorption of the fluconazole or not increase the absorption of the fluconazole. And excellent cerebrospinal fluid penetration. This used for systemic candidiasis and cryptococcus meningitis. Fluconazole have excellent cerebrospinal fluid penetration, and because of this property, fluconazole is used for the systemic candidiasis and cryptococcus meningitis. So this is the pharmacokinetics of the fluconazole. The next topic is antifungal spectrum of fluconazole. In which type of condition we can administer fluconazole? So fluconazole can be used for the systemic candidiasis, cryptococcus meningitis, prophylaxis for the infection after bone marrow transplantation, and prophylaxis and AIDS infection. We can administer fluconazole in case of the systemic candidiasis, in case of the cryptococcus meningitis, infection of the meninges by the cryptococcus fungi, and also use in prophylaxis for infection after bone marrow transplantation, and also use in AIDS patient for the prophylaxis of the infection. So this is the antifungal spectrum of the fluconazole. Next topic is adverse drug reaction of the fluconazole. So fluconazole have a wide therapeutic index and have low side effects and may produce GIT discomfort and skin rash and have low side effects due to wide therapeutic index. So this is the antifungal spectrum and adverse drug reaction of the fluconazole. The next topic is uses of the fluconazole. So fluconazole may be used in case of the oropharyngeal infection and can also use in esophagus infection and use for the infection of leishmania, which is known as leishmaniasis, and use orally. Fluconazole use orally, dose up to 100 milligram per 6 weeks for the treatment of the leishmania infection or for the treatment of the leishmaniasis. So that's all about the fluconazole. I hope you will understand and enjoy our today's lecture. Otherwise, if you people have any question or any confusion regarding today's lecture, so you people can ask me in the comment section. So thank you so much for giving me your useful time. Thanks.